Between 1848 and 1949, Central State Hospital in Indianapolis, Indiana, tortured the most vulnerable people and caused the deaths of at least 20,000 people with a range of health conditions and mental illnesses. In 1827, Indiana legislature authorized funds for the Central Indiana Hospital for the Insane, which opened in November of 1848 and sat on the 160 acres of land in Indianapolis, Indiana. Before the building was even completed, 5 patients were admitted and placed under the care of Dr. Richard J. Patterson. In an announcement to the public in the February 1st, 1851 newspaper, the Covington People's Friend, the status of the ever-growing hospital, the conditions it treated, and how the patients was published. This magnificent edifice is nearly completed at an expense of $85,000, cheap in comparison with the cost of other states. It is admirably adapted to the purposes for which it was designed, can accommodate about 150 patients, is already filled, and will soon require construction of another wing to accommodate the victims of insanity. The patients are about half males, half females, and their insanity is attributed to the following cases: ill health of various kinds, intemperate drinking, abuse from drunken husbands, excessive use of tobacco, loss of property, ill treatment from relations, domestic afflictions, religious excitement and anxieties, intense application to study, disappointment in love, epilepsy, want of occupation, false accusation and imprisonment, indulgence of temper, jealousy, exposure and fatigue, excessive use of quinine, disappointed ambition, spinal irritation, surgical operation, loss of sleep and exposure, Mexican War excitement, Millerism, pulmonary disease, injury to the head, masturbation, reading vile books, and mesmerism. Some of the inmates are raving maniacs and kept in secure rooms, secluded from their fellow inmates or visitors. Others mingle together in wards, males and females separated, however, as also the good from the evil disposed. More than 1/4 of the whole number admitted are annually cured and restored to their friends and usefulness. The May 5th, 1852 newspaper, the Madison Daily Madisonian, revealed that even spiritualists were being admitted, saying that 6 patients have lately been admitted to the Indiana Hospital for the Insane whose insanity was caused by the spirit rappings. These conditions, all being treated in one place, can confuse modern audiences. However, at the time, all were seen as abnormalities in the brain caused by lesions or hemorrhages or lack of morality. Dr. Patterson was also a proponent of the idea that women could go insane because of delayed menses, which damaged the central nervous system and eventually worked its way up to the brain. He retired in 1853, and Dr. James S. Anthem became the next superintendent, carrying on his predecessor's ideas, but also shouldering a very costly operation that taxpayers were already growing tired of. The December the 30th, 1868 newspaper, the New Albany Daily Ledger, ran an article outlining the ever-growing need to house and feed more of the patients at taxpayer expense, stating, "The work upon the north wing has progressed very satisfactorily, and the eastern half of it will be ready for occupancy on the 1st of January. By that time, the appropriation will have been exhausted, and a further amount will be required to complete that extension, estimated at about $30,000. This extension will greatly increase the capacity of the institution, but it will still be unequal to the real requirements, as an estimate shows that the number of insane persons in the state is from 18,000 to 20,000, the ratio being 1 to each 824 persons of the population. The cost of sustenance for each patient is, in round numbers per month, as follows: flour, $1.51, beef, $1.92, sugar, 32 cents, coffee, 37 cents, tea, 28 cents, butter, $1.30, other provisions, $2.27. The total is $7.97. This will be found upon investigation to be at least 33% below the Army ration or any other established standard of diet." By 1870, a new superintendent, Dr. Orpheus Everett, was tired of seeing the patients suffer in deplorable conditions and with little food because of the lack of funds from the state. He wrote to the state governor, John M. Palmer, saying, "The basement dungeons are dark, humid, and foul, unfit for life of any kind, filled with maniacs who raved and howled like tortured beasts, for want of light and air and food and ordinary human associations and habiliments. Normal wards are without adequate or intelligent provision for light, heat, or ventilation, and patients are forced to sleep on beds all straw upon forbidding skeletons of iron." However, his frustration was ignored, and 2 years later he resigned. Conditions didn't get any better after he left. However, thanks to one brave man, the state would soon learn about the inhumane treatment in the institution. Albert Thayer, a Civil War veteran who had become a successful publisher, he was subject to the harsh conditions and terrible mistreatments while a patient at the hospital. After he was discharged in 1884, he went on to publish what he had seen and experienced inside. This started a patients' rights movement. Dr. Everts had read Albert's first-hand experiences and wrote into the newspaper asking for others who had been patients to tell their horror stories. All of their accounts were printed by Albert in a pamphlet titled The Indiana Crazy House. In the pamphlet, which shocked many readers, Albert attributed most of the atrocities he and others went through as being from lack of state funds. He wrote that the lack of money meant less food for patients, poorly trained staff, and a lack of supervision and oversight by any employees. Still, nothing was done about any of the concerns brought to the forefront. That same year, the so-called rest cure became popular, but became an excuse for patients to be restrained in chairs, in cold tubs, or in beds for sometimes weeks at a time. The replacement superintendent, Dr. William Fletcher, was one of its proponents. This treatment was widely championed by neurologist Silas Weir Mitchell as a cure for emotional disturbances, and was especially effective in treating anorexia and what was called hysteria. Hysteria was once considered an illness in women which led to ungovernable emotional excess. A woman could get this diagnosis by doing or saying anything that violated traditional gender roles at the time. Choosing not to marry, for instance, would have been evidence to doctors of the time of hysteria. It was removed from the Diagnostic and Statistical Manual of Mental Disorders in 1980. The treatment was simple. A person took to their bed for 6 to 8 weeks. However, only the richest could afford to do this at home. This so-called treatment was forced upon many patients inside of the institution, leaving many with bed sores that went untreated and sometimes permanent muscle loss. The negative press saw legislators set up a committee to investigate the claims. After their report, the institution was ordered to become more self-sufficient. The quaint farm colony spoken of was actually a vast farm that provided most of their grains and vegetables. Male patients, who could be trusted to be out of their wards, worked the land. A cannery was also open, so that the food could be stored and eaten during the colder months. Women were given jobs as bakers in the kitchen, as well as given the task of sewing all the clothes for the patients. Because of the backlash from the published accounts of abuse from former patients, Dr. Fletcher applied for more funds from the state, promising to find evidence of how mental illness was carried in the bodies of those that passed away inside of the institution during autopsies. First, he hired a female gynecologist, Sarah Stockton, to oversee the women. In 1885, a school was opened inside the women's ward, and the next year the men had their own school. The power plant was completed that year as well. The institution was energy independent. In 1889, the institution was rebranded the Central Indiana Hospital for the Insane. Finally, in 1896, the pathology department was completed. Dr. Fletcher would autopsy those patients who passed away and were especially interesting to him to see if he could find any traces of insanity in their bodies or locate any abnormality in their brains. Afterward, they would join countless others in unmarked graves on the property. A truly atrocious concept is that of eugenics. It was a set of beliefs and practices that had started circulating in medical circles in the United States around the same time that Dr. Fletcher was trying to find insanity inside the bodies of the victims of the institution that he ran. Its core principles were that anyone suffering any sort of mental illness or deformity was a drain on societal resources, so many women admitted to institutions were given hysterectomies to prevent them from passing along their mental illnesses to their children. An April 8, 1898 newspaper article from the Quincy Journal encapsulates this attitude, saying, "Miss Mary Healy, 40 years old, has been declared insane, and she will be transferred to the Central Indiana Hospital at Indianapolis. Last week, she left to visit the Hams family and sang them all. The next morning, while the family were at breakfast, she pointed to the grove nearby, remarking, "Is that where my father hanged himself?" Hams answered in the affirmative, whereupon she sprang to her feet, exclaiming, "That's where I will die." From that moment, she has been a raving maniac. For many years, she has been the sole support of an old and informed mother, Miss Indiana Healy. Several weeks ago, a married sister took her to Cincinnati. The separation grieved Mary, and this, coupled with her inability to secure employment, helped to develop hereditary insanity. In 1905, work was finally completed on the Seven Steeples building. It would go on to house the women, while the men remained in the original structure. One peculiar part of the building's construction was that the first three levels were underground. The patients with the worst behaviors were placed in the lowest levels, alongside any black women that were unfairly sentenced to the institution. It's clear that patient safety was never the institution's priority, and, being understaffed, allowed murder and suicide to take place in the walls and on the grounds. One of the hospital's most infamous suicides was that of a man who had murdered his whole family, and was documented in the January 20th, 1906 newspaper, the Quincy Daily Herald. George Ford, who killed his wife and three babies with a hatchet, and then set fire to his house near Vevey several months ago, while demented, committed suicide by hanging at the Central Indiana Hospital for the Insane. Dr. Max Baer was superintendent of the institution from 1924 to 1951. Under his supervision, it changed its name to Central State Hospital, and by 1928, the complex has held 3,000 patients. He continued the questionable medical practice of his predecessors. He paid special attention to any incoming patients with syphilis, while other medical professionals at the time were using small doses of arsenic to cure this sexually transmitted infection. Dr. Baer was injecting the patients with malaria. This mosquito-borne parasite causes flu-like symptoms, and many of his patients died from this so-called treatment. Their bodies would be added to the innumerable dead buried in unmarked graves on the property. The 1930s saw both hydrotherapy and insulin shock treatments as promising treatments. Dr. Baer took full advantage of both, and some of his patients passed because of them. Hydrotherapy was another way to calm the behaviors deemed inappropriate. A patient would be soaked in hot water for extended periods of time to calm them. Much more dangerous was the use of insulin as a treatment. Patients were injected with high doses of insulin to keep them in comas for several weeks. It was mainly done on patients who suffered schizophrenia in an attempt to reset their brains. Obesity and brain damage were the most common side effects. The unlucky ones died. Dr. Baer secured state funds to barely meet the required space for a growing population of mentally ill people. In 1938, the administration building was completed. The institution was vast, with many buildings. All were connected by 5 miles of underground tunnels. They were constructed with the purpose of providing power to each building, but the designs were more insidious. They were large enough for someone on a stretcher to be pushed from building to building, but also had rooms where it was alleged by far too many patients that others would be chained up to the walls in. Since the U.S. Army had successfully begun treating syphilis with antibiotics in 1943, Dr. Baer had begun experimenting more with electroshock therapy. This barbaric torture was first pioneered by the Italian neurologist Ugo Cerletti in 1838 to treat schizophrenia. Doctors were performing this practice without the use of anesthesia or muscle relaxers, so the patient was awake and would often break limbs during the seizures that the practice produced. The observable side effects of having electricity ran through a patient's brain is what prompted doctors to consider it a miracle procedure. A patient would become docile, or if misused, would revert back to an infantile mind. Many of Dr. Baer's more problematic patients couldn't even feed themselves after their so-called treatment. For the patients who somehow miraculously survived the 1940s were a time of lobotomies. This is now a well-known and horrendous practice where a surgical instrument was used to sever connections in the prefrontal cortex to make a patient more compliant. Many of these went horribly wrong, and people left in a childlike state were sadly the luckiest ones. In 1952, the institution would begin admitting those who society deemed immoral again. That year, homosexuality was classified as a sociopathic personality disturbance. Electroshock therapy was used on countless men and women that were admitted to the institution in attempts to cure them. The ones that did not survive the treatments were added to the unnamed dead on the property. Homosexuality wouldn't be removed from the Diagnostic and Statistical Manual of Mental Disorders until 1973. In 1974, the first classes of psychiatric drugs were being used, somewhat successfully, and there was yet again a rise in patients admitted to the institution. That year, 3 buildings named after previous superintendents, Evans, Bolton, and Baer, were constructed over the site where the men's building had once stood. Conditions didn't get much better for patients, though, and in 1994 it was finally closed because of the countless allegations of abuse and mistreatment of patients by staff. All that remains of the hospital at the time of this recording is the pathology department, which is now the Indiana Medical History Museum. Many parts of the land can't be built over. However, it's estimated that around 20,000 unmarked graves of patients who died while supposedly receiving medical care still remain.